Hello.
Hello, I'm Christopher Hobbs, and a licensed acupuncturist, PhD, research scientist, and herbalist. And I'm here today to talk with Casey Hirsch, who is a licensed clinical social worker specializing in autoimmune disease and chronic illness. And she is also the founder of Light Your Sparkle.life. And today we're going to have a conversation about Casey's new venture and Light Your Sparkle. And so the first question I'm going to ask is, Casey, how did you start your Light Your Sparkle project, and what led up to that?
Well, it's sort of a culmination of my entire life. I've spent, since I was 1 year old struggling with chronic illness, and eventually I was diagnosed with autoimmune diseases. And throughout that process, getting answers was very difficult. And it felt like I would get a recommendation from a physician or a healer, and then actually enacting the recommendation was really difficult because information could be confusing. So I'd spent a lot of time, accessing information online, reading, and I found that information was never in one spot. It was always in different parts. It was very fragmented. And as a social worker, our job is to bring resources together and make them user-friendly. And I wanted to start a website and a project that had a number of integrative resources available for people to access all under one roof, all in one spot. One, I hoped that it would reduce some stress, because it's very stressful when you're not feeling well and you're on a search to try to figure out what you need or to understand what you're being told. And there's so many different interventions out there. There's many different places to go for healing. It can be exhausting going from site to site, talking to so many different people. And sometimes you just feel like you're spinning around yourself. So it was my hope to bring resources together with Light Your Sparkle and to give some hope as well as, accessibility. So that was the number one reason that I was compelled. I started collecting, resources through the years, documenting things that had worked for me, people that I had seen, things that I'd heard about, and I started to put them together, and then it ended up going into the website. And, I also just really wanted to give back. You can feel really hopeless, and you can feel your self-worth and your self-esteem can really be taxed when you're dealing with chronic illness and also emotional traumas. And I wanted to help others, and I felt like part of my gift in this world is to give back to others despite the challenges that I've had. And if I can help one person and make their journey a little easier, then it really feels good to me.
Yes, that certainly, I understand what you mean. As a medical researcher and practitioner in California myself, I really know how hard it is for a patient or a person that is on a healing path with any particular ailment, especially chronic illnesses, how hard it is to comb the internet. Nowadays, it's so vast, and you don't really know who's selling something out there and who really has experienced what they're talking about and really has a lot of experience and good insights. So I certainly know how valuable that is today. And what Light Your Sparkle, where did that come from?
Well, the name for me is really valuable because the concept of sparkle has always brought me joy. I love the light, the energy behind, anything that sparkles. I'm also passionate about international Latin ballroom dance, and everything with ballroom dance is about sparkle. So just visually and aesthetically, and the way that it makes me feel is very positive. Aside from that, healing involves so much energy, and it's a mind, body, spirit process. And so the idea of light and lighting your sparkle has just a very nurturing and healing feel to it. And I've discovered in my own journey with healing that the more you have a relationship with yourself and the more you discover who you are, the easier it is to heal. And that's an ongoing lifetime process of getting to know yourself, building a relationship with yourself, and figuring out, what your body needs, what fills your spirit. So the idea of lighting your sparkle is just that, finding the things that give you life and living your life from the essence of who you are and what makes you, feel alive. So that's where Light Your Sparkle came from.
Well, there's no doubt about that. I usually say, follow your passion, or,
Mm-hmm.
your path with heart. There have been various phrases or concepts used, but I think it all pretty much means the same. Not only love yourself, take time to go in and see what's going on, inside,
Mm-hmm.
rather than always going out. And so that sounds great. That's a good way of putting it.
Thank you.
So I know we've talked before about your challenges with autoimmune disease and Crohn's, and another reason why you started your project. And so I'm just wondering, when you were first diagnosed with autoimmune disease, the Crohn's, and what it was like before you were diagnosed. What did it feel like when you didn't really know what was going on?
Yeah, for sure. It's been a long road. I have so many diagnostic labels attached to my name that, it's daunting. And I've had to realize I'm not the label. I'm still Casey. So as a young child, I had a lot of childhood illness, and I left the doctors in sort of a quandary. They really didn't know what was going on with me. I had literally hundreds of antibiotics that I was prescribed. And I had seen, specialist after specialist, doctor visits all over the place, and had many, many diagnoses at the time, migraines, endometriosis, anxiety, depression, chronic fatigue syndrome. As I, got into my young adult years, I started to gain the labels of, interstitial cystitis. And meanwhile, I always had many, many complex gastrointestinal symptoms that, complicated the whole thing and made the ability to kind of hone in on a symptom really difficult. So eventually, after many, many tests, I was in my early 30s, and I was finally given a diagnostic label of Crohn's disease, which is when I realized I'd been struggling with some form of an autoimmune condition my whole life, despite the fact that I also had many allergies, and I'd had allergy testing and a lot of things that indicated my immune system was struggling. So it's been a long road, but I would say it wasn't until we really honed in on the gut that we started to make sense out of my condition and had a direction to go. And then that's when we decided that the label Crohn's disease was the most appropriate for what I was struggling with. Are you still there, Chris?
What did you, at that point, what did you know about autoimmune diseases and, the basically pathophysiology, or the
Mhm.
physiology behind the symptoms that you were feeling, did you really have any understanding about what an autoimmune disease was?
Yeah, I mean, I knew on some level it was very comforting to have the diagnosis, Crohn's disease, to actually like kind of guide treatment, because we had ruled in and ruled out various parts of my body. I mean, we went through the female organs, we went through neurology, endocrinology. So that was really comforting to know, okay, now I have a direction, seems to be most focused in the gut. So at that time in my life, when I got the diagnosis, I was a young woman, a young adult, past my young adult years. I was an adult, and so I had more skills to be able to cope with that and to find resources to help myself. In the prior years, I brought a lot of frustration with the medical system, a lack of hope, and I really, in some ways, believed that physicians were the answer for everything. And this was during my childhood, well into my teenage years. And I thought, you go to the doctor gives you a prescription, the doctor tells you what they think is going on, and then you proceed with that because they're the expert. So going into, my adult years, having had so many challenges with the medical system, I was still in the mindset that you're at the mercy of that system. And it gradually began to change, of course, as I started to learn about new healing modalities and alternatives. And then I started to realize that there's a lot more to know. And by the time I was actually diagnosed, I was much stronger and had a lot more tools and a better understanding of what it meant to have an illness. That being said, autoimmune in my 30s was a vast topic. I mean, like to where to go and what to do with a diagnosis like that was overwhelming. And just because I had a name didn't make it much easier to understand it. So I was still quite confused.
Well, there's still a lot that we don't know about autoimmune disease and why it happens and why it happens to some people and not others,
Mm-hmm.
and how, of course, how to treat it effectively. There's still a lot more to learn about it.
Mm-hmm.
But how has your knowledge of the mechanisms of autoimmune disease, how has that changed over the years? And you must have learned a lot.
Yeah, I have. And so today, my understanding of it is very different in my perspective. I don't believe that anyone is an expert on my body other than me. And that has really changed, my approach to having the diagnosis and the way that I live my life. So no longer do I feel that I'm at the mercy of diagnoses or treatment recommendations by a physician or healer. I feel like I'm the one in charge and I'm empowered to make decisions that are best for me because I live with myself every day. So that is one thing that's definitely changed. I'm not as scared of having Crohn's disease as I used to be. When I was first diagnosed, it was really scary. The information that was given to me, had descriptions such as progressively will worsen, that it's incurable, that it's not a matter of if I have surgery, it's a matter of when. And these things were just really terrifying to me, especially coming in from so many, years of severe illness. So I was very fearful. And now my approach is much more hopeful. My perspective is much more positive because I know there are many different ways to heal, and I look at what's available to me, and I look at what I know about my body, and I can make decisions that are better for me. And I also know that it's a matter of something going imbalanced in my body, and that is mind, body, spirit, emotional, physical, and all of those areas are equally important. And it's more like this is a message that there's something that's gone awry in my system, and now I have to work to find ways to balance it, and also to find ways to restore the strength of my immune system, because my immune system is at the heart of all of this. So, and that has helped me dramatically move forward.
Though certainly the immune system is a key to autoimmune diseases, but as we both know, all the different systems of the body work together. So the our neurological system and hormonal system, immune system are also interlinked.
Mm-hmm.
So so what types of, I know over the years you must have tried a lot of different treatments.
Yeah, definitely.
Supplements and so forth. So maybe you can just kind of give us an overview of your thinking and how it's progressed, and what has actually worked and what hasn't.
Yeah, and I like what you just said. I really appreciate that, because the number one thing that I've learned about what has worked is that every part of the human body, the mind, the body, the physical, the emotional, the mental, it all works together. And so to just look at, for example, my gut and just focus on my gut is not going to provide me the same healing as looking at all the organ systems and all the systems within my body, but also within my environment. So, I'm reacting to and responding to stress that's happening in my personal life, in my home environment, the good things that are happening around me. So my focus in treatment for my body nowadays is very, very concentrated on holistic healing and integration, finding techniques that work on the emotional aspects of my day-to-day life, my past traumas, past childhood traumas, and how I find joy in my life. That's passion, things that make me feel good, and the physical. And that's, nutrition, making sure I have good supplementation, making sure that we're monitoring blood work. Prior to, this information, I was very focused on the physical. I believed that, the body was sort of one-dimensional, and you address the symptoms by some intervention. And I've really grown to understand that healing for me did not progress in a positive way until I started to integrate the emotional aspects of illness. And there were many parts. So, nowadays I'm drawn to treatments that incorporate the physical and the emotional. And that's primarily alternative healing. I spend most of my time in alternative healing approaches, and that includes supplements as well as a variety of holistic healers who do everything from, acupuncture and chiropractic techniques to allergy elimination approaches to energy medicine. It's very vast, the interventions that I'm open-minded to do and the things that have helped me.
Yes, that really has, as a practitioner and a healer, I certainly know, and of course, healing myself over the years, I certainly know that it's important to try many different things, not to focus too much on the exact symptom, as you said,
Mm-hmm.
or even organ, and consider it really, how can I be healthier myself? How can I increase the health of me totally? And then, so that's also incredibly important.
Mm-hmm.
And then just keep trying things, and if they don't work, then they drop away, and then just try new things. Of course, there is a point where you're just chasing every new fad. That's not good
Right.
either. But it's important to have an open mind, to try as many things as possible. I'm sure you found that as well.
Yeah, and I think it's important, like you say, to have an open mind. We limit ourselves by our cognitive constructs and, medical models and evidence-based practices. And the human body, our mind and spirit are very complex, and each person's very unique. So I have found it to be incredibly important to be open-minded. And And as long as I'm trying something that I know isn't going to do any harm, there's no reason why I shouldn't be open to a lot of different types of alternative approaches, because it's sort of a process of lighting your sparkle and figuring out what does your body resonate with, what can you use that heals a part of you, and everybody's different. So, number one for me is absolutely keeping an open mind. And I have been very surprised at approaches that I didn't believe were going to help were actually the most profound. And I do believe now in many of those.
So over the years, and especially in chronic disease that goes on a long time, and over the years, it certainly takes strength and it takes inspiration to keep following a healing path and not become discouraged. So what have been your inspirations?
Yeah, you're right, Chris. It can be very, very challenging. And, the whole concept of resiliency is really important to me. Like how you build internal assets that allow you to overcome and continue putting one foot in front of the other despite struggles. And I feel like, in my life, up childhood to the present, I have really had a sense of relationship. And people around me, and bringing into my life people that are there and can support and nurture where I'm going with my life and essentially who I am. So my strength is highly derived from my husband, who is a very strong support for me, friends, and people in the community, healers, my integrative team of healers. And these are people that care about who I am, see me for who I am. They actually get me and they want to understand me. And that feels so good, to just have somebody in your life who you can count on, who really respects who you are and where you come from and where you want to go. So that's a huge source of strength for me. I'm also really passionate about ballroom dance. In my life, that is such a joy for me. And, when I feel like I can't go on, doing a protocol, or I get, depressed, or I start to lose hope because I feel like, is this ever going to end? I have that aspect of my life that just takes me into this great, joyful place. And, I'm also really attached to my pet companion. I've always had a pet companion, and that is just a really, joyful place for me also. And these are all things that give me strength. And I've never lost hope. I've always believed, and partially that's because I have an open mind, that if you have hope, that there is always the potential that something good is going to happen around the corner, and you've never exhausted all your opportunities. They're always there. And if you maintain that belief, it really helps you put one foot in front of the other and keep going.
So true, Casey. And, um, you know, inevitably, when we are dealing with chronic illness, we sometimes ask, I wonder what caused this? Why me?
Yeah.
And those are, I know, in working with patients for so many years, many people ask that. They say, what happened? Why did I get this? Why did this happen to me? So I can ask that question.
Mm-hmm.
What do you believe caused the illness? But really, as I think we both know, there's not necessarily a cause.
Mm-hmm.
It really is. Some people say karma. Obviously,
Uh-huh.
it's just my karma.
Yeah.
Some people might think that, well, it's toxins in the environment that I was exposed to when I was young, and others might say, I didn't eat right, and of course, a big one is always, I had a bad upbringing, and I had an unhappy childhood. So, there are always plenty of things to blame and to
Yeah.
think about. Why did this happen? So I'm just curious to hear your thoughts.
Yeah, and I think that's really important. It's a really important question. And when I started doing research for the book that I'm writing, I I discovered there was a concept called the explanatory model developed by Arthur Kleinman. And this dates back over a decade, but he wrote a book called The Illness Narratives, and in it he discusses the importance of asking patients what they think the cause of their illness is, and asking patients to, in their own words, describe where they think it came from. And it was, I guess, maybe at the time astonishing, but that each patient really did have a story for where they thought the illness came from and what caused it. And in my life, my story has been really important because it's not about going back and passing blame or trying to make things more complicated than they are. But in order for me to understand myself and to really know who I am and what I need in my life, I had to understand where I came from. And in the process of understanding my history and my childhood and sort of the evolution of the disease process, which I've actually spent a great deal of time trying to understand for myself, I came to realize just what you said. There are many, many, many causes to what brought me to actually have a disease process in my body. And there are some major obvious players. I had very, very, very many antibiotics. I mean, just too many for my body to handle. And I had them at a very young age. And I also had a lot of stress in my home growing up. There was a lot of trauma. And these were all things that no doubt had some effect on my immune system. And then there are a lot of unknowns. But knowing who I am and knowing that history has been really important for me to create my own story. My own story has helped me have a direction for how to move forward with directions for healing.
Yes, and those are good thoughts on that. And that's, of course, something that's so important for many to understand the root causes of their illness.
Mm-hmm.
And probably another question, do you think over the years, has your your insights grown, and how have they gone more from the physical problems to maybe spiritual issues?
Mm-hmm.
What do you think about that?
Yeah, it's kind of been a progression. I started out my life very focused on the physical. And then when I wasn't getting better, and I'm a therapist. I mean, I'm actually a mental health therapist. I lived and breathed the emotional world, yet there was a disconnect between the emotional world and emotions and traumas and stressors from my physical symptoms. And so as I evolved and grew and learned more, I started to gravitate towards the emotional at the expense of the physical. So it went physical and then emotional. And then I was very focused on, how can I resolve the past trauma? How can I feel good about myself? How can I start to love myself? How can I, all these questions that were much more focused on my emotional state. Change your thoughts, change your life. And then in the last really 5 years, I've been much more focused on the spiritual. So it's gone in kind of stages for me. And I feel like now I'm at a place where I get, aha, I see it. Everything is connected. It's physical, it's emotional, it's spiritual, it's joy, it's passion. And now I live a life that actually it holds all of those dimensions as equally important and all together. But it's been a process of, disconnect and, really having a hard time letting go of the focus on the physical at the expense of the emotional. And so today I am very focused on, what happens in my thoughts, what happens in my environment, how do I feel about myself, how different triggers might set off emotions that, you know, are based on some past memory that I have. And the spiritual part is what keeps me grounded, you know, belief and, you know, love and joy. I keep going back to joy, and also just really honoring the essence of me and having some value for myself, and just believing in who I am, and really going towards what lights my sparkle, what makes me me. That is so important today.
Yes, good insights. Of course, I always think too, all of these different possibilities, but then at some point it's also good not to overthink everything and
And
just enjoy, just
yeah,
relax and enjoy
so
and
true. So
flow.
true. And very important.
So after all of the experiences that you've had, all the thinking and research that you've done, you're such a valuable resource. What tips can you offer to people who are just discovering now that they have an autoimmune condition?
Hmm. I think it's just really important to remember that you are your own best expert, and to hold on to that. Never discount what you know about yourself, what you believe, and, you know, who you are. And that is, I think, by far number one. It's also super important to create an integrative team of health professionals that you can trust and who see you as part of the team, and you're a valued team member. And I say integrated health professionals because it's usually not one healer or one physician that can guide you through a complex disease, or even complex, you know, emotional traumas. It's important to have people with different perspectives on your team that can support you and offer insight. So, and there's an important part of having a blend between traditional medicine and interventions and alternative and holistic, because they're very complementary. And knowing that you can blend both worlds for your benefit just opens up so many doors for healing. I mean, I like to go to my functional medicine physician and get lab work done and find out, you know, what's my body saying from that physical standpoint, and then be able to use that to go over to a naturopathic healer or an acupuncturist to work on how to strengthen my system more. And it's just, those are just really important tips. And to just, you know, remember, hope is so important. Empowerment, these are the philosophies behind Light Your Sparkle. Hope, empowerment, you know, you're an expert in who you are, and just choose things that make you feel good, because healing isn't about just taking a pill or just, you know, performing some intervention someone suggests. The things that make you feel good and make you want to get up in the morning, and the quality of relationships you have, are just as important. And how you spend your time is just as important with healing as anything else. And integration and fusion, being able to bring together many parts of your life, your relationships, and the system that you live in to create a unique healing approach. There's just not a one size fits all. Everybody's different. And so remember that what works for someone else won't necessarily work for you. Find your unique approach.
I'm going to second those thoughts, that's for sure. I know that what you're saying is right on. So you consider yourself or think of yourself as a mental health therapist. And how does your experience in that realm as a mental health therapist, how does that influence your perspective on chronic illness?
Yeah, and like I was saying a little bit earlier, it's surprising to me how even within my field there is a disconnect between the physical and the emotional. And as a mental health therapist, living in emotions and dealing with traumas and stress, it's sometimes astonishing to me how, we can disconnect from the physical and just focus too much on the emotional. So as a therapist today, it's just super important to remember that, each of us have physical and emotional components. And I really do I look at autoimmune through the lens of the person's entire life and what happened to them when they were little, positive or negative, and how that influences these patterns of beliefs and patterns of the way we respond to pathogens and things like that. I look at everything in that systems oriented approach. And I think that being a mental health professional has just really allowed me to see the importance of acknowledging that trauma does matter. The stress response in the body from trauma is huge. It causes inflammation. It lights up the entire system and definitely can weaken the immune system. And day-to-day stress, fight or flight, it's very real. When you're responding throughout the day like there's a saber-toothed tiger that's about to eat you, your system's resources are taxed and it's hard to focus on healing. So I'm a huge advocate for finding ways to reduce stress and finding ways to heal the past so you can be more in the present.
Certainly agree on that. And moving from the psychological then to the physical, what do you think the role of diet is has been in your overall treatment?
Yeah, diet's really important. I have been told through the years, especially when I was in my earlier years when I was diagnosed with Crohn's disease. At the time, I was told that diet wasn't important, that I could eat whatever I wanted and it would have no impact. And, obviously that school of thought is dramatically changing, but diet's important. I eat really clean, organic foods. And I'm also very aware that there is no one size fits all diet. There are so many out there. And it's easy to get caught up in one particular diet and to say, okay, this helped so many people with gut issues or fatigue, and to try it. And then if it doesn't work, to get very discouraged. And the reality is we're all different. So, a lot of the diets that have been recommended for Crohn's disease have not been congruent with my body. And so I take the best of all of them, and I have found a blend of foods and nutrition that works for my body. And I think everybody should do the same.
Oh, most definitely. I always thought that, when we grow up, we're eating our parents' diet. We're
Yeah.
eating the diet of our parents who may or may not be conscious about health at all. But, it's just what maybe also just what they fancy as far as taste and mouthfeel, or just how it makes them feel.
Mm-hmm.
And they don't, and what we really need to do is go into it and try as many different foods as possible,
Mm-hmm.
and play with our diet until we find one that's just right for us, as you're
Right.
saying. So, what do you think overall? What aspect has been the greatest struggle?
Yeah. I think it's really hard to maintain your self-esteem and confidence when you're struggling with chronic illness. Unfortunately, in my life, my ability to feel good about myself has been very connected to things on the outside of me and things that I do rather than who I am. And so when you have a chronic illness, there's such a thing as remissions and relapses. And there are days that I wake up and I feel, fairly normal. Like whatever that is for me, I feel it. And then there are days where I can barely get out of bed, or I'm in a lot of pain, and maybe I can't, do what I was supposed to do. And, I had years where I wasn't able to consistently perform at a standard 8 to 5 job because I did not know what was going to happen from day to day. So it's really hard on one's self-esteem to have the inconsistencies, and to also, it feels like it's tough to fit in. It can be very lonely having a chronic illness, being able to participate for things as simple as like family functions, where in my case my diet is fairly regimented for my needs, and being able to fit in with food, which is a very social thing, especially at family gatherings, and in my case. So sometimes I just feel like I'm alone, and I feel like I just don't quite fit in because I have this lifestyle that is sort of driven, or at least holds what I do on a day-to-day basis, and that can be a struggle as well.
Yes, thank you. Um, so I'm sure you have thought a lot about and worked with a number of different practitioners over the years. And I know some patients that I've talked with in the past find one practitioner and they really stick with them for many years and aren't much for trying new things.
Mm-hmm.
But other people come in and they go from practitioner to practitioner,
Yeah.
and they just practitioner shop basically. So, and especially in a place like Santa Cruz where I lived and where my clinic was, because there are so many holistic practitioners there. So, how can you give people on how to find a good team of practitioners and how they might fit in and how they might work together and to your best benefit?
Yeah, boy, I wish I had an easy answer for that. It really is a process. I tell my clients as a therapist that when they come and see me, I really want them to feel a connection to me and to feel that there's some trust and safety, and that they can relate to me. And if they don't like me, or if it doesn't feel like a good fit, that they essentially interview me and find out if what I have to offer is going to work for them. And if not, then that they explore other clinicians. And I feel like that's the way it is in finding the folks that are part of your integrative team. It's really, going in and meeting with a physician or healer and finding out how it feels when you're in their presence. How do they listen to you? Do they allow you to impart your wisdom and your expertise on your own body that is so vast, and then make decisions based on what you bring to the visit? And are they able to work with you and communicate with you and respect who you are and what you bring, and have a patience and a nurturing for the parts of you that might be scared, or whatever's happening in your life that might make it difficult to maybe apply certain interventions. So these are all things that we have to think about when we're choosing people that are part of our health team. And it takes time to get to know those different folks, and I've explored a lot of healers and physicians that I on one visit said that doesn't work for me, and having patience, knowing that it's important to find the right fit. And eventually, I've been able to create that for myself, but it does take some time. And if you're fortunate to find it in the first, couple of visits, then that's amazing.
Yes. Well, for me, if they have a good sense of humor and they don't overcharge, those are good things too.
So true, because doing what I just spoke about is unfortunately very expensive. It's expensive, with or without insurance. And through the years, many of the folks that are on my integrative team are non-traditional, healers, and they're not insurance based. So, it's not something that you can rely on having an insurance policy to help you pay for. And it can be expensive no matter which direction you go when you're just interviewing people. But I will say that most, especially in the holistic healing world, most practitioners are very open. I've experienced that they're very open to doing, brief telephone consults, calling and just saying, can I have 10 or 15 minutes of your time to see if what you offer is a fit for me? And I have found that when I ask for that, surprisingly often it happens. And I can have a small consult over the phone or really with the practitioner and get a sense of what they offer. And especially in alternative medicine, it's much, much more available because they want to be a fit for you also. And then, the office staff are very helpful. They can answer many questions. So sometimes it's a process of doing that as well.
Yes, it's all you say. It's not easy,
Mm-mm.
though, finding the perfect practitioner, and especially if you don't live in a place like Santa Cruz, which is just basically wall-to-wall natural practitioners, or
Right.
if you live out in the countryside or in places where there aren't many, then it can be a real challenge. I know that.
Yeah, and then it becomes much more important to focus on word of mouth and getting referrals from people that are already in your network. Sometimes a friend of a friend or a colleague will have a recommendation, and you can start there. Starting somewhere can lead to somewhere else if that's not the final stop.
Yes, exactly. Which reminds me, it's a journey.
Yeah,
It's all a journey.
absolutely.
And there's no, and in fact, it's pretty close to life. I mean, if if you're sick and then you go to practitioners and you change your diet and you're doing everything, you're doing a lot of different things to help yourself, and finally you and it isn't time to say, well, that's it, I've arrived.
Right.
It's going to be a lifelong journey because aging itself, I can tell you for sure, aging itself is going to require change throughout your life as you go from one stage of your life to another. So you're never really have arrived. So that's why building a healing team, as you say, is so valuable, and a network and family and friends and all of those things that carry us through our life. And, it's so important to give back too. It's so important to love others and have good relationships and a healthy family. To me, those are the most important things, really, are right up there at the top of the most important things throughout
Absolutely.
our life. So it's a lifelong journey.
It is. And I think it's important, for me, it's been important to remember that I'm not looking to be so-called healed, because there's always more healing to do, whether it's, in my thought process, my emotional state, the way I, respond to stress, and the physical. There's always more healing to do. Like you say, as we age and we go through life, things just can continue to happen. So, and it's also important, I think, to remember that our teams change, our relationships change. People come into our lives and they have just vital roles in it for precisely what it is that we need and we've asked for at that time. And then the team will change, the relationships change, and that's a good thing. I always think that if someone's been seeing, for example, the same psychotherapist for 5 years, that's a long time. Change is good. It's good to get new perspective and to keep oneself fresh with new relationships too.
Yes, let the healing begin.
Mhm.
So thanks so much, Casey. Those were wise words, and I really appreciate, and I'm sure your listeners are going to really appreciate your words of wisdom and your experience. And so keep tuned in.
Well, thank you so much, Chris. I really appreciate your insight and spending this time with you.
Yes, my pleasure.